developments over the last few years. And I also just wanted to do a little plug for my short book that I've just done with Routledge, which is you can download it as an ebook from the Routledge website, which is really covering some of the material that I will cover in my introduction. So we'll start with the policy development. We've had to give you a little look each time. So just press one. Yeah, thank you. So what I wanted to sort of point out in terms of the policy agenda is that we have a number of different kind of opportunities, but also challenges. And this isn't just in the UK and Finland, but I think internationally. Obviously, this field is an international field, but its development has maybe been quite uneven. So a lot of the initial attention was to developments in arts, health and wellbeing in the English-speaking countries like the UK, America, Canada, New Zealand and Australia. And I think that is just a function of language. I think more recently there's attention to work that's going on in the Nordic countries, but also beyond that as well. So this really is a kind of international field, although I would say its development is uneven. But across all the different countries, I think we have some common opportunities and some common challenges. So the first opportunity is, how to address the kind of healthcare needs in societies. So we're talking about healthcare needs arising from demographic changes, so people living longer, not necessarily living healthier lives for longer. So also an increase in prevalence of chronic conditions, increased prevalence of mental health issues and problems to do with well-being, and also issues arising from social change, including sort of migration, but also social inequalities. So I think policymakers have to think about how they're going to address some of these challenges. And if you look at an issue like elderly care or dementia, for example, I think it often is the arts are viewed as providing an opportunity to address some of those challenges, to support people's well-being in a way which is satisfactory to patients and the public, but also low cost and sort of divert some of the pressure from health services. So that's a kind of key issue. It might appear differently in different countries, but I think it's quite common across many countries. I think the next challenge or the next opportunity is that there are increasingly a number of senior policymakers who are willing now to advocate for this kind of work, who have become convinced. So in the UK, we had Lord Howarth of Newport, who drove the whole Arts and Health parliamentary, all-party parliamentary group and produced the Creative Health Report. So, and I know you have people like that in Finland. So I think that the advocacy and finding local champions, whether it's in national policy or in sort of local government and cities, I think that's been a key development, and that's really important. And I think the other opportunity, which I can see on the landscape, is that certainly in the UK, we now talk a lot about assets-based approaches, and there's a lot of funding and research going into what that means. And organisations like Nesta, which is a kind of innovation organisation, are researching a lot of this, and they're talking about kind of drawing on social movement theory, which is something I talk about quite a bit in my book. So the idea, in a nutshell, is that rather than finding new cash to support health and social needs in the community, there isn't an endless supply of new cash. But what we do have is lots of assets in the community. We ourselves are assets. We have community groups, we have activities, we have resources in the community. And if we can somehow find a way to harness these to address common challenges, then that is going to be the kind of an important aspect of the future of healthcare. And arts-based approaches are central to an assets-based approach in health and well-being. If you think about the number of local arts activities, so we now have lots of research around things like social prescribing, where a doctor will refer a patient to maybe a local singing group, or they will try and find out about what the local craft activities are in order to try and increase the asset base for the things that they can utilise as healthcare practitioners. So it's really important that artists are kind of tuned into these ways of thinking, because they do represent really important opportunities. They also represent some really big challenges. So if we think about what the challenges are, obviously we all know the first one, funding and resources, because even though we have lots of assets don't reproduce themselves for nothing. You know, if we don't feed the asset base, there won't be an asset base. So in the UK, people would argue that arts have been chronically underfunded, and that there may be questions about how fair it is to expect arts organisations to pick up the kind of gaps in funding of, you know, other kinds of provision. So funding and resources is always going to be an issue. Then there's the issue of kind of power and inequalities, and this is sort of really all down the kind of through the whole system. So we have increasing health inequalities and well-being inequalities. And there is a danger that if you just leave the arts to just sort of propagate themselves and develop themselves, that we have something called the inverse care law in health, which means that the people with the greatest need are the least likely to enjoy the most beneficial service. So it's where health organisations maybe cater to the worried well, but don't necessarily cater to the people that we call hard to reach. And so that contributes to inequalities. And there's a similar issue in arts and culture. So people who participate in arts and culture often have higher well-being than people who don't, but it may be that the arts and culture isn't the thing that's providing the well-being, it may be the thing that's actually reinforcing an existing inequality. We do have some evidence that if you use arts and culture in a targeted way, you can actually help to reduce health inequalities through the arts, but it has to be thought about. It's not something that happens on its own. And then the final challenge in this bit is for policymakers particularly, is to try and understand what works, because, you know, policymakers are quite hard pressed. They have to make choices between different funding, what different programs, what to fund, what not to fund, whether the benefits of something justify the funding allocated, whether something's going to have an adverse effect or an unintended effect. And policymakers need good evidence, but they don't necessarily always have access to that. Research processes are very slow. They don't necessarily produce evidence rapidly. And I've been working for the last 4 years with a centre, What Works for Wellbeing, in the UK. So this is a centre set up by the Cabinet Office. We have 7 What Works centres in the UK. So we have the National Institute of Health and Care Excellence, NICE, which some of you may have heard of. That's the What Works Centre for Health. We've got the Centre for Ageing Better. We've got centres focused on early learning, and we have this What Works Centre for Wellbeing. And over the last 4 years, we've been doing evidence reviews to try and figure out what's the best evidence for different culture and sport kind of programs, because our section of this program is culture and sport. So we've done evidence reviews of music, we've done evidence reviews of visual arts and wellbeing, we've looked at outdoor leisure, we've looked at dance and physical activity, and quite a whole range of programs, and done some big sort of evidence reviews and systematic reviews, and even managed to produce a kind of meta-analysis in some instances, which is very difficult to do in this field, just to show that there is a link between singing and preventing depression in older people. So that's a kind of a small piece of evidence which is very scientifically robust. So it's good, you know, to know about these programs. The website has got lots and lots of resources, and they're all free to download. So it's worth having a look at the What Works for Wellbeing.
The only thing I might add to that overview that encompasses so much is, from a practitioner point of view, as somebody who is trying to negotiate with health partners about the role for the arts in health organisation, the other thing that has been both a huge challenge and a big opportunity is austerity. 20 years ago, when our health system was perhaps better funded, the arts were quite marginalised. It was quite difficult to get clinicians or health managers to think seriously about using creative approaches to solving health problems. But as budgets have become tighter and more problems are in the system of how to deliver good healthcare, so I find that health managers are quite eager to look at creative solutions in a way that they weren't before. So austerity has created a lack of funding, which is one of the big challenges both in healthcare and in the arts. But I think it's also opened doors and created space for creative practitioners and healthcare practitioners to try and co-produce solutions to difficult problems.
So the other area that I'll just briefly give an overview of is research. So there's a number of issues in terms of recent development. So one of the things that I'd say is that we have a growing evidence base. I've just talked about the What Works for Wellbeing programme. There are other resources and repositories available. There's something called the Repository of Arts and Health Resources, which has loads and loads of evaluation reports and studies. It's no longer the case that we don't have evidence for arts, health and wellbeing. We might have gaps in evidence, but we do have quite a substantial evidence base. So that's a really positive development. We also have now sort of a growing awareness of the need for different types of evidence. So within our What Works Centre programme, for example, we do systematic reviews of peer-reviewed published evidence like randomised trials, etc. But we also do grey literature reviews, so we have a call for evaluation reports and we go through all of those. And we also do concept analysis of qualitative literature. So the last evidence review that we did was a conceptual review of loneliness, because loneliness has become a big topic in the UK. I'm sure it's an important topic in Finland as well. And what we did was sift through lots of qualitative research in order to understand how people are conceptualising loneliness and what kinds of interventions might address different kinds of loneliness. And we came up with sort of 3 different kinds of loneliness, and they are actually quite different. So we have social loneliness. So I would suspect that certainly in the UK, most participatory arts projects are addressing social loneliness. So social loneliness is a perception of a deficiency in the quality and the quantity of one's social connections. So feeling that you don't have enough friends, or you don't like the quality of the friendships, or that you're isolated. So social isolation and loneliness are often used synonymously. But there's a lot more to loneliness than that. So we also have emotional loneliness, which is the loss or desire for a very specific kind of relationship, so that you might find that in bereavement. That's the most obvious example. And interventions that only target social loneliness may actually make things worse for people experiencing emotional loneliness. So this is why it's useful to think about the different kinds of loneliness. And then there's also existential loneliness, which is something that we all experience from time to time, and it's that awareness of our aloneness in the world, and we might experience it at times of when we're facing kind of terminal illness, or when we're around someone who's experiencing that. So those sorts of different kinds of loneliness do have different bearing on what kind of interventions. So the message really is that when we're devising an arts intervention, it's really important to sort of conceptualise the challenge and the problem that we're trying to address, in order that the intervention can be, properly tailored. But the good news is that, we're now aware of the value of different kinds of evidence. So it isn't just about quantitative research, it's also about qualitative and arts-based research, which we will talk about a little bit later. And then the other thing that's been a shift is, as part of this conceptual thinking, is not just to focus on the outcomes, so what are the effects of the arts, but to try and understand the underlying mechanisms and processes. So what is it about this activity that leads to this kind of outcome? What's going on, whether it's a physiological process, or it could be more a psychosocial process, or the mechanism and the process of change might be more located in the social construct or the social conditions. So really trying to understand the mechanisms and processes What that requires, I mean, it does bring challenges because it requires a multidisciplinary, interdisciplinary kind of work. And I doubt that the answer is going to rely solely on one kind of field and discipline, because we do have a slight reductionism, a tendency towards reductionism, that if we can find a biological cure for everything, or a genetic cure, or a physiological answer, we kind of think that's the holy grail. Because quite often these things work in very complex systems, so it's not so much one variable that's going to help us understand. So the processes that we've been looking at in our What Works program are processes connected with, say, belonging and identity, processes connected with social capital, other kinds of processes around sort of stigma and inclusion. So there, it's also really important to try and understand the mechanisms and processes. But these different sort of topics and questions, they all require very different research and evaluation approaches. So it's really important to think about your evaluation question when you're starting out on a process, because your question might be a mechanisms question rather than an effects question. So we'll talk a bit about that later. And then I'm just going to finish off with some research challenges. So the first one is, obviously I've talked about this is increasingly a multidisciplinary area, and there are multiple standpoints. So what people want out of evaluation might be very different compared, depending on their standpoint. And I've worked with groups where the conversation will start with, well, we want to find out whether this affects mental health. And some stakeholders will be very convinced that that's what they need to find out. And then when you work through the process with them and say, well, if you want to find that out, okay, this is what you have to do, this is the research design that you need, and this is a tool that you would need. And they say, oh no, we don't want to use that because that's far too intrusive for our clients, our group, our participants. And also that's just going to disrupt the process, and also the consent issues are too difficult for us to do this sort of, So then people often will reevaluate their positions. And I think the whole point about multiple standpoints, and we emphasise this a lot in our work, is getting people together at an early stage to thrash out to understand the different standpoints and try and come together with a kind of shared vision for a programme and its evaluation. Otherwise you do run into problems later down the line. So as well as multiple standpoints, we do still have an issue with hierarchies of evidence. So that's the premise that some sort of evidence is of greater value than others, and it does depend on the question. So if you're trying to find an answer to a very effect type question, what was the effect of intervention A and intervention B on a very specific kind of condition, then the best methodology for that is usually some kind of experimental randomised trial if you can do it. But that doesn't mean to say that other sorts of evidence aren't of value. And some kinds of evidence don't really fit into the idea of a hierarchy of evidence because they're asking different kinds of questions. So we still have a problem around that. And we also have a problem around knowledge, translation and communication. So programs like the What Works for Wellbeing programme rely on very highly skilled knowledge translation. So we're the researchers, we go away and spend a year doing a systematic review and an evidence review, and we publish a report, which could be about, some people will download and read that, but the policymakers want something they want a page of A4, and ideally with some sort of visual graphics and a kind of infograph or whatever, and that's not our skill set as academics. So we need to work very closely with people who are good at knowledge translation and that kind of visual representation. But then there are issues that come along the way because things get there are issues about what happens during the translation, and you have to be quite careful that the kind of findings from a research study don't get sort of changed along that journey. So it's very challenging, but also very useful to have these sorts of collaborations. And then I just want to say, before we carry on with this day, which is all about evaluation, that there is more to research and evaluation. So we're talking about a very specific topic here today, but I wouldn't want you to think that we're talking about the entirety of arts and health research, because there are so many more questions that we might want to answer which don't fit with an evaluation model. So if you want to talk about that at any stage, please do. And then before I hand over to Jane, I'm just going to quickly whiz through the practice issues as I see them, but then I'll let Jane talk about this because she's much closer to practice than I am. But just to outline what the sorts of headings. So the key, in terms of the practitioners that I talk to, one of the key issues is how to engage with policy, research and practice, because there's a perception sometimes of the unequal relationships, or the language isn't necessarily the same. And I think in Jane's first example, there was a good example of that. How to make a sustainable programme, how to get the resources, because in the UK we have a large number of charities. A lot of this arts and health work is done by charities and third sector organisations, and they survive on one project grant after the next. But these project grants don't necessarily fund core functions. They'll fund a project, but then so they're always having to think of the new project and the next project. And actually that's not helpful if you're trying to look at a long-term intervention that's going to have a sustainable effect. So how do you achieve sustainability in that kind of environment? We have questions about if something really works in one area, shouldn't it be scaled up so that people from different areas can access those benefits? How do we do that? How do we scale up arts and health? Do they lend themselves to scale, or are they specific local relationships that we're talking about, and how do they propagate? And this is where in my book I talk a lot about social movement theory, because social movement theory is very good at understanding scale and propagation, and it's also good at understanding issues with engagement with research. So that's why I've used that in the book. And then I think, okay, and then boundary work, which is also something that I talk about a lot in my book, which is really about how artists are boundary workers, so they inhabit one sphere, but they move between spheres. And also we have artistic objects which move between spheres. So something like a blood sample, for example, has a very specific meaning in a clinical context. But if an artist is doing an installation based on that, then that meaning changes in that different context. But the object is the thing that's moving about, and its meaning is intact in its different worlds. It still means something in this world and it still means something in this world, but it has this kind of capacity to be flexible and move around. And in doing that, it kind of can bring people together for different kinds of conversations. So when you have, boundary objects can be successful or they can fail. So I would say that a successful boundary object is something that stimulates a new kind of conversation and a new way of thinking and a new kind of reflexivity. Whereas traditionally, say, if you're using an arts object to convey a health education message, basically you're translating medical knowledge to a lay audience without anything coming back the other way, then I wouldn't necessarily consider that a hugely successful boundary object, because it's not achieving any sort of interdisciplinary exchange, it's just actually reinforcing a hierarchy. So I'm going to hand over to Jane, because I've talked enough, and she's going to continue.
Or maybe say the
same thing in a different way.
Perspective, because this has been such a fantastic collaboration to have running through my career, because it's a bit like having a framework or a sounding board through which to ask questions and through which to reflect on practice. So as a practitioner, as a producer, as a commissioner of arts programmes, one thing that strikes me is that in the UK we've been particularly bad at being able to articulate what we do, why we do it, and the impact it has. So I've always found it very challenging when people say to me at a dinner party, "What do you do?" And if I say I'm an arts, health and wellbeing consultant, they often say, "Oh, do you paint murals in hospitals?" And I have to say no. So for me, evaluation is a way of interrogating what we do to be able to understand the mechanisms of what it is we're doing and why they have an impact. So your question is perfect. It's what's actually happening. And as arts practitioners, we need to be able to articulate that. Otherwise, what happens is health partners view it as some kind of magic. Some kind of, oh, well, some magic happens, there's no way of explaining it. Well, I think you can explain it. And I think the really important thing about being able to explain what we do and why we do it is that the more we can articulate what practice looks like and what good practice looks like, the more we can improve the quality of work, the more we can understand the skills and professional competencies that artists need to practice in this setting, and the more we can ensure that the work that's delivered is safe for artists working with vulnerable adults or children in different health settings, but safe for participants as well. So I think, for me, evaluation might be about proving what we do to advocate for funding, but actually more important and exciting is being able to understand what we do so that we can improve the quality of practice, to grow the field as a whole, to grow the way we practice. And that's also important, and Norma's mentioned here about scaling and propagation. So a question I get answered very often by policymakers or funders or coordinating bodies in the UK is, how can we scale it up? And that's a really challenging question, because sometimes what really makes the work effective is the deeply rooted relationships out of which the work grows. And what I sometimes see happening is somebody sees a project and they say, wow, it's a great project. So we'll take that, we'll copy it, and then we'll deliver it over 10 locations. And because they haven't really understood properly the mechanisms for what made that project work, they lose everything that's great about it. They repeat it and they go, it wasn't so brilliant after all. So as a practitioner, my passion for evaluation is deeply rooted in how, what is it, what's this work all about, and how can we improve the quality of it, and how can we improve people's understanding of it. But as I said in the introduction, if you move to the Creative and Credible slide, our relationship started with a conversation about how frustrating it was to try and talk to a health person about research. And Norma helped me understand the difference in language and perspective and culture. And I think we quickly came to see that there was this huge gulf between academia and research and arts-based practice, and it was quite difficult to communicate and talk, and even more difficult to collaborate. So Creative and Credible, the Creative and Credible program really, was 2 academic knowledge exchange projects. So within my arts organisation, we had a full-time researcher for 2 years, and then another full-time researcher for a further year. So that was an amazing opportunity. And what we were trying to understand was, how can we better evaluate arts and health programs in a way that is both credible to academia, to researchers, but credible also to health partners, but importantly in a way that was creative, by which I mean appropriate to the settings, the context of the arts projects being evaluated. But I think in the true spirit of knowledge exchange, while I was learning huge amounts from Norma and the university and our researcher about what good practice looks like in research terms, hopefully, as a creative practitioner, the arts has a lot that it can share with academia and research about creative thinking, creative practice that can be applied all the way through the evaluation cycle. So Creative and Credible was about understanding the challenges of evaluation and how to overcome them in ways to make it more robust, but also looking at the opportunities to embed creativity into evaluation practice. What we found briefly we had a sort of action research steering group of policymakers, researchers, artists, practitioners, and over a year we met many times and looked at different challenges and issues. I think what we found when we looked at the problem of evaluation was that a lot of evaluation practice was being carried out by arts practitioners. And they had a lack of time to do this. They were doing 3 or 4 other jobs at the same time. They had a lack of resources. Both the money to commission evaluation wasn't there, the time wasn't there to do it, the skills and capacity weren't there, the understanding of evaluation and the skills to evaluate weren't there. But the other problems were that often the projects were very small. They might last for 6 months and then they would finish. And so you had lots and lots and lots of little tiny projects being evaluated, but nothing happening at scale and no sense of how to join up all the little projects to come up with findings that would be in any way credible. There was also no consensus about what tools to use. There was no single framework, rightly so, that could be applied. So there was a lot of confusion. And the confusion was made worse by this separation of language, where we would use the same word but attach different meanings to it, like research, for example. But there were some opportunities too, and I think there was clear consensus through the research process that perhaps the biggest opportunities were about co-production. That if we were to come up with ways of evaluating that met the needs of healthcare partners, artists and participants, that the process of deciding what to evaluate, what questions to ask and how to ask those questions should take place through a process of collaborative working. The other opportunity, I think, is to look at the role of creativity in that process. And thirdly, I think the opportunity is to use evaluation perhaps to give bigger prominence to participants' voices, to really understand better the experience of patients and participants so that we hear more about their needs, their experiences, to inform the way we develop projects in the future. So as part of the tools we developed a website with lots of resources and information and PDF handouts, and there's a postcard for each of you if you want to have a look at the website. We deliver training across the UK in different aspects of evaluation, but a key part of all of this has been the evaluation cycle that we developed through the research process. And whenever I'm teaching arts practitioners in the UK about evaluation, I think if they take one thing away from the workshop and nothing else, the most important thing is to understand that evaluation needs to be a process that starts with reviewing the evidence base to inform both a project, but also to shape thinking about what to evaluate. And that moves all the way around a circle through to disseminating the findings. Because what I find, I don't know about here, and maybe if projects are led more from universities or from research bases, this is not an issue. But in the UK, what happens is when people come to me and say, will you help me evaluate a project? The next question is always, tell me what tool to use. Immediately, what tool shall I use? Shall I use a questionnaire or shall we use focus groups? And so I'm trying to get people to understand that by going straight to data collection, they are skipping a really crucial part of the process of thinking. So the evaluation cycle encourages people, first of all, to use the existing evidence base. So if you have a project that's about art and dementia, then go and find a similar participant group where research has been carried out into the impacts of a similar project. How can you learn from the evidence base to inform your practice? But also, how can you use that evidence base to maybe see where the gaps are, to see what isn't already fully understood, or to think about how to shape your evaluation. And then the next stage of the the evaluation cycle, Norma, you referenced it before about the importance of consulting people and developing consensus around aims. Because again, in the UK, when people evaluate, they often try and answer about 6 questions. They take a project's aims, and maybe it has 6, 7, 8 aims. So they construct enormous, ambitious evaluations, and then they realize they can't collect enough data or analyze the data to answer all these questions. So our advice is always to find the most important question that you want to explore and focus your resources on that. It's better to do one thing really well than try and do lots of things and do it less well. The third station here in purple sounds a bit obvious. The next phase, having looked at the evidence base, having identified your evaluation question, is to develop an evaluation protocol or plan. But people don't plan when they do evaluations. They just launch into it. They say, oh, we're going to collect all this data, and they don't think about exactly when they need to collect the data or how they're going to analyze it or who's going to analyze it or who's got the skills to analyze it, or even thinking about ethical issues. Is it really ethical for the artist to hand out and collect in questionnaires if the artist is the person facilitating a very close, intimate group? Does it need to be somewhere else, somebody else come to do that? And I always say the process of planning is important, because for me personally, I hold my hand up every time I do an evaluation plan. I go through the whole process, and then I get to data analysis, and I think, I really can't analyze 5 focus groups. It's too much. And then I have to go and reprioritize and make it simpler and more focused. So if resources are minimal, if there's a lack of time, if you're working with a small team and the skills are not always there, the importance of planning becomes absolutely vital to make sure that you do less but do it really well. So we're going to look at data collection tools in a minute, so I won't go any more around the circle at this stage. But before we move on to that, in a way we've kind of answered this question of why evaluate, but it is the first, after you've looked at the evidence base, it is the next stage of the circle. Why are you evaluating? And it's amazing how often I might sit down with a team of people engaged in a project and they want to evaluate it. But when I say, but why do you want to evaluate it? They either don't know, or there might be 6 different answers to that question. So sometimes in the UK in particular, it's because the funders tell us we have to evaluate. So it's about accountability. And going back maybe 5 years, most of the funders who were funding this kind of work, when they talked about accountability and evaluation, really all they wanted was monitoring and audit. Did you do what you set out to do? Did you deliver a 10-week program with 14 workshops? Did you reach the people you said you would reach, or how many people took part? It's only more recently that people have been interested in understanding outcomes and impacts. So it could be that the evaluation is to understand the impact of a project. What change did it deliver, or what impact did it have on participants? But increasingly, I'm thinking that might not be the most important question to answer, because quite often, if a project is fairly small scale, there's an increasing evidence base that we can draw on to look at whether a particular arts intervention will deliver particular outcomes. And if there are not many resources and it's a small project, perhaps it's better to think about the other reasons that you might evaluate. So that could be a process evaluation to understand how to improve practice, or it might be exploring the impacts and the process to try and understand the mechanisms for change, the essential ingredients that make a project successful or not. And never forgetting that within all those questions, be open to what went wrong, what didn't work, what was really challenging. And what I've found on more than one occasion is those answers about what was difficult, what was challenging, what didn't work, they sometimes don't come out during the formal evaluation process. And I can think of a few occasions where everything has appeared to be very rosy, very positive, and afterwards I've informally met the artist who's been delivering the project, and the artist has said, yes, it was fantastic, wasn't it? I really enjoyed it, it was great, but actually, you know, now there were really difficult times, and there were points where I went home in tears because it was a very difficult situation to be in. And these stories, I find, don't always come out through the evaluation process, because often the creative practitioners think that they shouldn't be experiencing that kind of thing. So I'm quite keen on setting up evaluation processes to really encourage honesty so that we can explore the challenges in the sector and look at how to introduce support, safety, mechanisms of support to deal with those as well as measuring outcomes. And I suppose that last point is about why do we evaluate? Well, it might be because we have a pilot project and we want to see how we can grow it, or we want to continue it to an ongoing project, or we want to take a pilot project from one region and look at how we could make it a national project. And again, we've mentioned already, that might be about proving outcomes, because if funders think that a project will increase mobility and reduce falls prevention in the elderly, for example, they are more likely to fund it. But I think, as Norma's book points out, even sometimes when you give people all the evidence, they still don't really want to scale up a project, because to effect change, one needs more than rational arguments. So I think a key question for evaluation in the next 5 to 10 years is better understanding the context for the work that is taking place, and trying to look at how we affect change, how we can change healthcare practices by introducing creative methodologies. And that might be not just about understanding outcomes. So I was interested, I can't remember who said in the introduction that you're already working with healthcare practitioners in social care settings, healthcare settings. I'm really interested in how you introduce creative approaches into healthcare practice as a way of introducing sustainable change. So on that note, I will hand back to Norma, who will take us to the next point.
Thank you. So I think we're going to make you do some work now. I think we've talked for long enough. So I was just going to say for the next bit, a lot of people think evaluation is about showing or measuring a change. And that is a really big part of evaluation. It's not everything, but I'm going to start with that because a lot of people think that, you know, that's what evaluation is about. And when it comes to commissioning and funders, you know, they want to see a change, they want to see an effect. So in public health, quite often people will use a kind of logic model approach or a theory of change. So is that something that people are familiar with? Or is it unfamiliar? Because I know in the arts, maybe people don't talk about theory, logic model, theory of change so much, but I know in public health, they talk about that a lot. So this is, again, an issue about the kind of interdisciplinary nature of this kind of work. So has anyone worked with a theory of change or a logic model approach? So some people have, but maybe not so many. So this is what we're going to ask you to do. We're going to ask you to try and start to devise a logic model for either a real project or a fictitious project. So the way this works, it is quite constraining, but bear in mind that what we're trying to do here is answer a question which is about an effect. So it's only for one kind of question. So the question that we're trying to address, the evaluation question, is of the nature of what is the effect of this project on participants and maybe well-being or mental health or creative skills or whatever it is. We're not asking, you know, all the other kinds of questions that you might want to ask. This is really focused around kind of effectiveness evaluation, and it is quite a standard public health tool. So I did this for Public Health England. In England, we have standard evaluation frameworks for, across public health areas. So they have them for obesity interventions, dietary interventions, exercise interventions. So it's a standard kind of approach. So I was asked if I would write one for arts, health and wellbeing. And so this is taken from there. So it's a kind of standard approach to how you might evaluate an arts project. It's not saying that everyone has to use the same methodology or ask the same questions, but if you're asking a question which is about effect and impact, then this could be a project. This could be a useful way of structuring an evaluation. So the first thing that is required is to identify all the different resources that you might need for this project.
Can I just frame this from an arts point of view, which, if you're not familiar, might help? Again, it's kind of an example of the way practice is shifting, in my experience in the UK. It used to be that arts organisations would come with an arts project and say, here's a really lovely arts project, and we think it will be really good for your older people or really good for people in hospital beds who can't move. Let's come and give you this thing because it will be good for these people. And often this was charitably funded, so the health partner didn't need to pay for it. It was like, here's a lovely thing, let me offer it to you. And the arts people would always be giving, giving, giving. And now there's a change in thinking, which I'm always trying to encourage artists, arts organisations to think about. And instead of saying, here, let me give you this, always start with a question. Always go in and say, what's your need? What are your problems? So you have patients, long-term hospital, in bed, they can't move. So what's the need here? Is it that they need to move to get blood circulating? Is it boredom? Is it frustration? Is it depression? Is it anxiety? What's the need? What's the problem? And it could be that there's 5 needs, but only one of them is a problem, because the other 4 needs are already met easily by the healthcare professionals. So I'm always encouraging arts organisations to identify the need and the problem, and then think about what they can offer that will be a solution to that need. So it's a much more of a dialogue about what's needed and what the problem is. And I think to understand that, it's not offering something, it's solving a need, make sense of this theory of change or logic model. If we do this, it will deliver this, which will solve this problem. Does that help?
Yeah, thank you. So the need that you're trying to address may not be something that you can easily measure. So evaluation in this instance is about things that you can measure. So if you can't measure it, what are you going to do? You have to measure something else which is going to be close to it. So we've got this column which is called primary and intermediate outcomes, and that's slightly arbitrary depending on your kind of the reality of your evaluation situation, because your primary outcome needs to be something that you can measure. It may not be the ultimate aim of your project, but you have to be able to measure it. So this is about an evidence production kind of model. So, but before we even get there, what I found working with a lot of arts projects is that the project itself is not well described. So unless we describe the length of time this intervention is going to last, the number of people and the types of participants who are going to be kind of identified, the resources, the staff training, the staff competences that are needed to actually deliver it, any kind of supervision or training needs that are required. Unless all that's really well documented, there is no way that the effects can be understood in any kind of context, and there's no way that the project can ever be replicated. So evaluation is also about producing things that can be replicated as well as measured. So unless we're reporting and describing our projects really clearly, there's a whole section of evaluation that we're not doing, which is really the kind of, so the first part of the public health evaluation tool is a reporting framework, and you've got a handout that we sent to you which takes you through how to describe an arts project. So that's like the baseline, if you like. There's also the planning and intervention, which I think we've talked about, and then we've distinguished between outputs, outcomes and impacts. So outputs are the things that you actually do, so the creative performances, the sessions that you deliver, the things that actually happen inside as a result of this project. The impacts might be the things that you're really trying to achieve, but you can't measure them. But you're looking, and there may be longer term impacts, which you can't measure within the timescale of your evaluation. But they might be things to do with changes in awareness, changes in practice, changes in policy. The outcomes are the things that you can measure, but you're not going to be able to measure all of your outcomes in a project because there are likely to be too many things. So in public health, people often talk about a primary outcome and intermediate outcomes. And the primary outcome is the thing that's closest to the thing that you want to achieve that you can measure. So in this instance, we've said it's mental well-being. And let's say this is about a choir project. So the primary outcome is, so we're going to target older people who are going to come to a community choir, and our primary outcome for that group is improved mental well-being. We want to show a change in their mental well-being, and we want to show, we can extrapolate from that change that we are going to achieve some other longer-term impacts, and we might have some evidence for that we can gather, like through media reports or things like that. But we're not looking for like the massively robust evidence in this column, because that's the thing that we can't really measure very easily. But if we can measure our primary outcome reasonably robustly, then we can build a model around that, which creates a good case for support for the project. So the intermediate outcomes might be the things that contribute to your primary outcome. So for example, we're going to have an enjoyable project. We want our participants to enjoy the project, because if they don't enjoy it, they won't come back and there'll be no change in their well-being. We want the project to be high quality. We want participants to perceive this as a high quality choir project. Again, if they don't perceive it as such, they won't come back, or they'll maybe feel dissatisfied, and the mental well-being won't be improved, because you only improve the mental well-being if you actually get people to attend and continue to attend till the end. So that you can have many, many intermediate outcomes, and we're not looking for sort of massive amount of rigour and robustness, but where it's important to be robust is with your primary outcome. So in the UK, this is why I think well-being has become really current, because well-being is actually quite easy to measure, and it's also a really good primary outcome for lots of arts projects, because it's something that's also realistic. Because if we're saying that we're going to cure dementia, obviously we're not going to do that in an arts project. So the primary outcome has to be something realistic that you can actually achieve. So if we say that we're going to improve mental well-being, there's a reasonable chance that we will do that in an arts project. There's a very good chance that we can measure that quite easily. So we have now, we measure well-being in the national census in the UK, and they do it through 4 questions. So there's just 4 questions. So there's a happiness question, there's an anxiety question, there's a question about satisfaction, life satisfaction, and meaning and purpose. So that's how we measure well-being. So that can be converted into an evaluation tool. And so the What Works Centre for Wellbeing has some really good advice on how to measure wellbeing in a community project. So lots of projects could address this quite easily. But what a logic model is just you take this all apart and you say, well, if we provide an enjoyable, high quality choir project that is well attended by older people in this community, we will achieve a change in primary outcome. So we will achieve improved well-being, and by doing that, this project will also contribute to broader and longer term impacts, which could be very specific. So that gives you sort of a handle on evaluation. This is one thing that you need to focus on and measure well, And the rest of the things, you can build the case for support and the evidence base around that, but it doesn't have to be quite so. So this is something that actually is really challenging to do in practice, because the choice of primary outcome is quite a pragmatic one, because it has to be achievable and measurable. It may be a little bit not absolutely close to the thing that you really want to achieve, but the thing that you really want to achieve may not be possible to measure. So what I was going to ask you to do, if it makes sense, is to think about a project that you're involved with, either a real project or an imaginary project, or a project that you'd like to do, or a project that you've been involved with in the past, and just work on your own for sort of 5 minutes or so to think if you can think about this theory of change. So how would your theory of change be phrased? You know, if we do X, we will produce Y, and thereby, you know, hopefully contribute to Z. So in order to do that, you have to hone in on what's going to be your primary outcome. And you have to be confident that you can measure it, and confident that it's achievable in your project and also worthwhile.
And I would add that this is a really, whether or not you evaluate, this is a really useful tool for project development. When you're planning your project, if you can really get clear about this, then you're likely to have a better honed project. But it's also a really good tool for convincing people to fund your project, or to finding health partners to partner for your project. What I've found in practice is if I talk to a health partner about a possible project and I say, this is what we'd like to do, here's the aims and this is the cost, I get maybe a good response, maybe not. But if I present it like this is what we'd like to do, this is what we'll deliver, this is why we'll deliver it, and this is the cost. If I present the proposal in this format, they get it. Health partners get this in a way that they don't always understand. So if I say, I would like to do a clowning project in the hospital and this is how much it will cost, it's like...
We start off with quantitative evaluation. And really my point here is that when we're talking about a primary outcome, we are talking about something that you can measure, and that is a quantitative change, a change from A to B that can be measured and represented numerically. It doesn't mean that you can't be creative about how you gather the information, so I'm going to let Jane talk about this late after the break, but she can tell you what this is about. But that's an example of how you might gather quantitative information without having to use a standard questionnaire.
So can you see there, that's instead of a questionnaire asking about people's ages, it's inviting people to put coloured balls in boxes. People enjoy doing it much more than ticking boxes on a questionnaire.
Yeah. So you can be creative even with your quantitative. The purposes of quantitative are monitoring an audit. You'll be doing a lot of counting. Measuring an outcome, goes without saying, that's a quantitative exercise. Measuring a change. Qualitative evaluation won't give you a project outcome. It will never give you a project outcome. But it can show sometimes people what they call soft outcomes. I don't really use that word because I think it's a bit confusing. It can be really helpful for examining how people experience a project. There's no point in having a project outcome if the project is not satisfactory to participants. So qualitative evaluation is really important. As I was saying before, qualitative research gives us our conceptual understanding of issues like loneliness or well-being. We can't really get there with quantitative research. Qualitative research will help us understand some of the project processes. Did the artists and the physiotherapists collaborate well together? Those sorts of process questions, quantitative work isn't really going to help that much. And showing some of the wider impacts, you know, looking at media analysis, looking at other sorts of qualitative tools. The most common thing we use is participant feedback, but there's other sorts of data out there that can be used, and it all can work within a sort of theory of change approach. A lot of us use sort of participatory action research, and that's just really important to flag up that this is a method which isn't a methodology, it's an approach. So the approach is that you work with participants around a kind of research cycle, that research participants and project participants all share the ownership, they share the decisions, they share some of the processes. So sometimes we train service users to act as service user researchers. So the whole process of participatory action research is that you don't do the evaluation and then get the results and then, in 2 years' time and then put it on a shelf. It's iterative. So if you find out something as you're doing this participatory action research, you implement that straight away. You don't wait for the end of... so it's a very different process to what they use in sort of maybe medical research. But it doesn't require a particular methodology. So your participants might decide that the thing that they need to do is measure something. It's really about choosing who decides what to measure and what kind of research approach to use. It doesn't sort of mean that you can only use qualitative methods, but qualitative methods are often used in participatory action research. And then there's sort of case studies. So a case study approach can be really useful. Again, it can be quantitative or qualitative. So, and a case could be any of those things. It could be a person, it could be a group of people, it could be a bodily part, it could be a theatre project. So really it's about, if you're doing case studies, it's deciding what is your case, what level of kind of case are you going to select, and also how you're going to select your case. Because there's something that we haven't talked about, which is really quite important, which is kind of issues of selection and sampling, to try and make evaluation processes a bit more robust. So if you're choosing a case study, why are you choosing that case? Are you choosing it because it's an exemplar? Are you choosing it because it's the best example? Are you choosing because it reflects the norm of what happens? So that's something we can discuss.
I think we've forgotten to flag up, but this is the next bit.
Oh, okay, yeah. So you can film this bit, yeah. And then the final bit is economic evaluation, and this is quite a challenging one. So, again, you've got say you've done your good outcome study. That outcome is no use to anyone if people don't want it. So you need the subjective accounts. But the outcome is also not very attractive to policymakers if it doesn't deliver with it a cost benefit. So it may be that you manage to reduce prescriptions of prescription drugs on an elderly care ward in a hospital, which is something we thought we'd done in one of our projects. We did a kind of slightly creative kind of controlled study where we looked at a hospital ward and looked at the level of prescriptions of antipsychotic drugs for people with dementia during one period, and then we looked at it during a similar period the following year where they'd had a musician in residence. So we looked at ward level data, we weren't looking at individual responses, and it showed that in period A, which was no music, and period B, which was music, in period B they had much lower levels of drugs being given out, especially on a Tuesday, which was when the musician was in. So it wasn't just that there were, there may have been overall global factors that meant that period B was different to period A, but it was on the specific day that the musician was in. So we were quite pleased with that as an outcome, but did it result in the commissioning of a musician in the hospital? Not directly, because there's other hurdles that you have to show. So prescription drugs are actually quite cheap. So you're not necessarily going to show, maybe something that would be of greater value would be a real prevention in falls. So, when you're thinking about your primary outcome, if you're working in this kind of health interdisciplinary way, you really do have to think about think about the mindset of the healthcare providers and the things that they need to, the boxes they need to tick. So that's why we sort of talk about, so economic evaluation is increasingly used as part of research design. So research designs are getting much more complicated these days. So most, sort of well-funded clinical trials would have a qualitative element, and they would also look at people's subjective experiences with the project and the process issues, and they'd also have an economic component to see whether or not the project created any cost savings. Sometimes people use social return on investment, which is a really complicated methodology. I'm not going to talk about it in great detail because it's not something I know a huge amount about, and I think it's something that's very, very difficult and not necessarily always that worthwhile to do. I think at the absolute baseline, and in the public health reporting tool, we have a methodology for how to cost a project. Because as part of your basic reporting information, it's really important to know how much does this project cost. So what are the financial resources, but also what are the resources in kind? So if it requires you to have a piano, if it requires you to have other facilities, this project can only be replicated when those facilities are present. So maybe they need to be included in the project costs. If it relies on volunteer time, maybe that needs to be factored in, because that may not be possible to reproduce in every context. So costing projects, there are sort of methodologies for that. It is quite important to be able to say how much this project costs per participant based on the duration of the project that you expect. So I think that's all we've got time for around methodologies, because after the break, Jane's going to take you through some creative evaluation. So this is the end of our sort of first session. So we have a break now for...
if you're just creative for the sake of it, then that's not evaluation, or it's not good evaluation. So why would we need to use creative methodologies? When would they be beneficial? And so we came up with a definition of what we mean by creative evaluation, which is not necessarily evaluating using arts tools. It doesn't have to be about evaluating by dancing or singing. What we mean by creative evaluation is any approach to evaluation that is innovative, that is multifaceted, which actively engages participants and supports the collection of high-quality data. Because really, the main benefits of using creative tools are, why would you want to use creativity when you evaluate? What might be the benefits? We were talking over the break, and you said very clearly, sometimes it doesn't feel right to give people a questionnaire. Why does it not feel always good to give people? If you're doing a creative project, why do you not want to hand out questionnaires?
Somehow stops the flow of the creativity,
Yeah.
the artistic process.
Yeah.
It feels like
it interrupts the project with something. People can find some evaluation tools quite invasive. They might not want to answer a questionnaire or even answer questions.
Even if I'm thinking about things what happens in your body during your dancing, it's something non-vocable.
Yeah.
It's not, you cannot reach it in words.
Sometimes if you ask somebody a direct question about how did you experience that? How did you experience lunch break? People are, it was nice. So often some of the standard tools we have don't give us very rich stories or data or information. And sometimes when we approach something creatively from the side or in a different way, we can get richer information. So creative tools can be really useful if you want an evaluation methodology that fits really well with the nature of your project. They can be really useful if you're working with groups of people who don't want to fill out questionnaires, who find them invasive. But they can also elicit much richer and more meaningful information from people than just a feedback sheet, for example. So they can be credible. If you use a creative methodology and you get 100% response rate, then you could say that's much more credible than a non-creative approach that gets a 60% response rate. So an example of that might be if you ask people to fill out feedback forms, quite often maybe 60% would do it at the end of a workshop. But recently in a training workshop, artists' organisation told me that instead of asking for feedback on bits of paper, they had got squares of coloured acetate. Do you know what I mean by that? It's like see-through plastic in different colours. Yeah. And you might use it in the theatre to put in front of lights, that kind of thing. And you can get it free because it's scrap, recycling. So they had lots of this in different colours and they cut it into squares. And they built a kind of chandelier with metal coat hangers and wires, and they invited people to write feedback on the acetate, and when they'd finished, to hang it on this sculpture. And so everybody could see their comments creating this sculpture in the room, and they wanted to be a part of it. They wanted to add something to it. So again, sometimes a creative tool can be a way of making people want to participate in evaluation because it's fun, it's enjoyable, it's rewarding, it's creative, it fits with the project. So often we use creative methods to elicit data. So we might use a creative method to collect feedback or to enable people to reflect on a question. But sometimes the data that we elicit might not be written or even spoken data. So if you are using a creative method, it's important to think about how you're going to analyse what you get. And it might be if you get a picture out of somebody, you also have to get them to talk about the picture so that you can use the narrative that they tell as the data that you can then analyse. So it doesn't have to use arts-based methods, but it might be about using creativity applied to your evaluation. So how can you innovate? How can you put unusual things together? How can you turn things around, think of new ways of doing things? And hopefully, if there's time at the end, we're going to do a little creative evaluation activity using some objects and luggage labels. So I've handed everybody a luggage label. But I thought I'd just give you a, because we've talked about lots of concepts without much detail, so I thought I'd show you a project in more depth. Fresh Arts on Referral was an arts on prescription programme which ran at a hospital in Bristol in the UK. And the programme was trying to support hospital patients with chronic long-term conditions. And in particular, it wanted to find out whether taking part in an arts activity could help patients with long-term conditions better cope with their long-term condition. So we worked with 3 participant groups. We worked with patients living with chronic pain. So these were people whose pain levels were so bad that day-to-day living was very hard for them. And they might live in the community and then be referred into a hospital when their episodes of pain became acute and they needed either painkiller treatment or they would have psychoeducational groups with occupational therapists. So trying to teach them how to live with pain better. And the second group was people who had received treatment for cancer. So they may have had surgery or treatment and they may have been given the all clear, but having been diagnosed, they then have to live with either the threat that it will come back, or they might be living with the impact it's had on their life and their ability to do things in the long term. So cancer even is seen as a chronic condition. And a third group was people who'd had an early diagnosis of dementia. And there we wanted to see whether participating in a group activity at that very early diagnosis stage would encourage them to go into the community and take part in other cultural activities to support them after leaving hospital after the diagnosis. So it was a pilot project. We had 3 groups. And each group of participants met with other patients with the same condition. So the chronic pain patients met, the cancer patients met, the dementia patients met. And we ran, it was a 6-week programme that each group went through, and we ran each 6-week programme 3 times. So that's 3, 6, 9 6-week programmes. Over a 9-month period. And in total, we had 65 patients who went through the programme. And the evaluation, so we wanted to find out, does taking part in a creative activity in a group setting with people in the same condition help patients better self-manage their condition? So we came up with a logic model where we chose well-being as the primary outcome that we could measure relatively easily using the Warwick-Edinburgh Mental Wellbeing Scale. So this is a questionnaire, and every patient filled out the questionnaire before they took part in the 6-week programme and at the end of the 6-week programme. And through that, we were able to have a numerical score which showed that overall there had been an increase in well-being. But that didn't really tell us the full story. And what we really wanted to know wasn't just about an increase in well-being, but was about, has it changed people's lives? Has it given them the confidence or the skills or the knowledge to then go back out into their lives and live better with their condition? So we did quite a lot of qualitative evaluation that was trying to understand their experience of taking part in the project. We ran a focus group with each patient group, and we ran focus groups also with the artists and the health stakeholders, the health partners. We did interviews with patients from each of the different health groups, and we collected feedback from participants all the way through the programme. So that was quite a lot of data, I have to say. As the person who had to analyse it, that was a lot of text to type up, to analyse, to make sense of. But I think very worthwhile. It was very illuminating. The focus groups in particular were amazing. We had between 8 and 10 patients in each focus group. We asked all the patients if they would like to volunteer to take part in a focus group, and I think 27 took part, so 27 out of 65. So that means nearly 50% of patients volunteered to take part in a focus group. And it's the focus groups that I want to just focus on for a minute, because one way of running a focus group would be to just sit everybody around a table and facilitate a discussion. But just as you were saying earlier, if you ask somebody a question about an experience, they're not always able to tell you the answer. And with these people in particular, they weren't necessarily people who were very confident about articulating themselves. So we wanted to have an activity that would both reassure people, put them at ease, relax them, but also give them a reflective space so they could just think a little bit about their experience before having a discussion. So the focus group started with a collage activity. And when the patients walked into the room where the focus group was, the tables were not quite that messy, a bit more tidy, but the tables were all spread with paper, glue, scissors, materials, different things. So they walked in and their first reaction was, oh, this looks familiar. This is the kind of thing we've been doing. This is going to be okay. I feel safe. So immediately they felt reassured. And what I asked them to do was simply to spend 20 minutes making a collage, reflecting on their experience of the project. So one question, only one question, and a very open question. What has your experience been of this 6-week programme? And then everybody sits and they make their collages, and I have to sit back and say, not much. And I'm always thinking, oh, will this work? Do they know how to answer that question? How is a collage going to help them answer that question? So they all make their collages, and then I invite them to pin up the collages on the wall as if we're making a gallery of the pictures. And I always invite, I never tell, because everybody always has a choice. If you would like to add your picture to the wall, then please do so. But if somebody wants to keep it private, I think that's really important. It may be that something upsetting has come up and they don't want to share it. So far, in several years of doing this, everybody has always put their pictures up, but maybe one time not. And then I have a wall full of pictures. So is that the data? How do I analyse those collages? I can't analyse the collages. So what I do is I invite each person to tell their story. So in a very low-key way to say, would anybody like to talk about their picture? And then what naturally happens is each person goes up to their picture and they start to explain what it's all about. And often, I believe, that they only really know what it's about as they give words to it. So I think there's something about the creative space of making something that gives people a reflective space, an imaginative space. And because they're making something with their hands, it's a way of taking it out of their heads and putting it onto paper. So it gives them a perspective, it gives them distance. And there's something about that distance that enables them to see it clearly, which means that they can then put it into words. So the collages are pinned up, and this is the bit where I actually audio record the stories. That's because I want to get the words exactly as they're spoken. I will ask for permission, obviously, and ethics and consent, and record people as they tell their stories. So I thought I would share some of and often they don't say very much, but they don't need to. So just to share a few of the collages. So this was one of the cancer participants. And as she put her collage on the wall, she said, "I'm leading a slightly eccentric 70-year-old life. I live alone. I hit a brick wall with the diagnosis. Life as it was just stopped. It was such a shock. Treatment, surgery, it was a mountain to climb. I'm left," and you can see here the imagery of, steps, mountains, brick walls. "I'm left with a permanent disability, frustrated and upset at what I can't do. I need to look forward," and we've got the pointing arrow and the signpost. It's about finding a new path. The path, she did this, the path is hidden in places, but keep following it and it will point to a new horizon and a new direction. So this in its own is one story, but this, alongside all the other data from the focus group discussions, the interviews, the feedback, I think starts to tell a very compelling story about change, about assets-based work, about agency, and about this woman's capacity to recover from trauma, to move forward, to find self-acceptance. The path is sometimes hidden. She's saying, I don't always know the answers, but keep going, trust, and you will find a way forward. So this is another one from the chronic pain group. And this woman practically performed her collage. She's, ta-da! A mind map about how we make decisions on what we do in art. And these are not artists. These are people who, at the start of the program, hadn't really done much creative work at all, ever in their life. But here, she is clearly articulating what it means to be creative. Here's a mind map about the decisions we make on what we do in art. The textures that feed you. Use everything around you. Jazz hands, man. Ta-da! Use influences to create magic, optical illusions. Use them to change, to make other things. Create your own reality. It's a survival skill. To be able to self-soothe, to be able to function, change what you see around you to comfort you. And you can see how she's kind of going, creativity gives me this. It means that I take the lid off my head and I can transform things with materials and paper and whatever I'm doing. And then she applies it to her own life and what it means and the skills she needs to live with chronic pain. I find them completely, I find it almost breathtaking that if you give somebody the chance, they can really articulate truths that are very deep, meaningful truths for them. So maybe just one more, shall we? Do you want to? I can't, I've got it now, I have to say it. So this is another chronic pain patient, and she says, detached, detached. So here we have detached. That's the word that started me off. I felt this, detached, and in a dark place. I was going from lost, a lost feeling, and coming here was a catalyst for my creativity, a ray of light. Others understood, so she's talking about the safety, the non-judgment in being in a peer group. We felt safe within the group. It was all right to be emotional. There was enjoyment, playfulness, relief. See a bit, connect with what you can do, that reference to assets again. This is where I have been, and I will probably always feel like this at times. Creativity is a good way of expressing it. And the last one, this was a man with dementia, and when he stood up, and he'd barely said a word through the whole session. So I felt really unsure about whether this was an appropriate approach to working with somebody who'd had a dementia diagnosis. But he stood up and he went to his picture and he just simply said, "This picture is me going into the class in a cage, and I open into a life full of magic." So I think those patient stories speak for themselves, really. And I guess what I feel, not as an academic and a researcher, but as a practitioner evaluator, is sometimes it doesn't matter how much hard evidence you have of outcomes. Sometimes the patients are the best advocates for the work. And using creative means to really enable patients to tell their stories of their experience of the work and the impact on their life can be very powerful. And as a result of this, the hospital trust that I was working with asked if any of the patients would be willing to speak to the trust board. And I didn't really want to go and directly ask that question myself, but the person project managing the project put a call out to all of the participants in the program and said, would anybody be willing to go and address the trust board? And 2 of the patients said yes. And it's really as a result of that this whole program has now continued funding. So it's the patient stories or the participant stories that I think are really important. So, yeah, creative methods. You still have to think about why you're evaluating, what you're trying to find out. You have to think about what kind of methods would put your participants at ease, what would they enjoy doing, what fits the group and the work. They can be more work. They're not always easier, but they're certainly more enjoyable, I think, most of the time. So I would encourage you to think about using them. And if you're a researcher, to collaborate with the artists running the program, to think about how you can maybe just not think about using them in focus groups or at the end of a program, but think about how you can embed them all the way through a project. Norma.
Thank you very much. So, time for a quick survey. So we're just interested in what your experience is of evaluation. So if you wouldn't mind giving a show of hands for each of these. So how many people have used quantitative methods in the evaluation context?
So, if we go back to the evaluation cycle, remember we started by thinking about how we use the existing evidence base, how we draw on research to both inform the development of a project, but also inform the evaluation to help us see what question we might want to answer. And then the next stage was about the aims. Why are we doing this? Is it something we want to publish, which will dictate whether it has ethics approval, how you set it up? what do the different stakeholders want? What do the funders want? What do the health partners want? How do we frame an evaluation so that it's really useful to the people who matter? We've touched a few times on the importance of planning, that if you don't plan for when to collect data, you might miss it. You might have really, really amazing conversations that happen, but you haven't recorded them or you haven't collected them. Also with planning, so important to think about how you're going to analyse the data, what tools, what approaches you might take. If it's quantitative data, perhaps that's more straightforward because it might just be about counting up the numbers and working out averages and means or percentages and presenting graphs or tables or pie charts. But if it's qualitative data and you've got pages and pages and pages of data that you've collected through focus groups or interviews or feedback, then planning is so vital because you've got to think about time, resources, skills to analyse all of that. Otherwise, your report is just this big bag of data, which isn't really a report. So having collected and analysed the data, then I think it's really important to think about how to best do the reporting, why you're doing it, who it's for. So the sorts of things you might want to consider is how formal should your report be? What context are you delivering your report in? Is it appropriate to use a kind of academic reporting methodology where you might have the introduction, you might talk about exactly what the project was and who you worked with and over what period of time and how many sessions you delivered? I think however you're reporting on an evaluation, it's really important to outline exactly how you undertook the evaluation. So what methodology did you use? And even if it's not a project with formal ethics approval, you might want to show the kind of ethical considerations that you put into place. So did you have consent from participants? Have you anonymized participants? How did you avoid bias? The more that you can show that when you're reporting, the more you're saying the evidence that I'm presenting you with is reliable evidence. But if you produce a report with lots of claims and you can't show how you came up with those claims, then it's not as reliable. But perhaps the report doesn't just stop with presenting the findings. I think it's really important to then think about, so what? What does this mean? What does this mean for practice? Or what does this mean for policymakers? What does this mean for funding? And that what does it mean might mean future research, but actually maybe it will mean training for arts practitioners, or maybe it will mean that in your next project you've really got to think about transport to enable participants to get to your project, because that was one of the findings. So I think that in order to be ethical about how we evaluate, the evaluation has to be useful. So the reporting, the evaluation report, I think has to really think through and show how you can make your conclusions useful in practice. What change might it lead to? But the cycle does not stop with reporting, because reporting is not the same thing as dissemination. And all too often what happens is a report is written and maybe it's sent out to people, maybe they open the email, maybe they read it, but the cliche we hear is that the report sits in the drawer, and so nothing changes. So sometimes evaluation has a bad reputation, a bad name. And I think that's because all of this planning and thinking and collecting and analysing and writing up, and it sits in the report and then nothing happens. And that's just a waste of time and energy. That makes my heart sink. So the dissemination phase of the cycle is just as important. So what might I mean by dissemination as different from reporting? Does anybody have any examples of having written a report but then found maybe creative ways of disseminating the key findings?
For example, we did with young people that we did blog posts
Excellent.
with them, and
Yeah.
they really engaged in it.
Yeah. Yeah.
And now they are very easy to send also for the funders, because sometimes they also want to have some recreational thing too, in addition to the report.
So with young people, social media, anything online is going to be much more accessible than a Word document. So a blog post is a great idea. Any other ways of disseminating findings?
Send them to me. Literally, in our What Works programme, we do these calls for evidence.
Yeah.
So we just put a notice up. I'm saying this, we probably won't do anymore, but the methodology has been send us your reports on music and singing, and we'll include them in our evidence review. And that's quite a good way for grey literature to become disseminated more widely.
And that's a really good point, because sometimes I hear arts practitioners say, well, how do I find out about what worked for other people? And how can I learn from what somebody's done somewhere else? And we might not be able to publish our evaluations in academic peer-reviewed journals, but we could make them freely available on our websites or share them through other, I don't know whether you have a website where you share resources across the sector. Because the more... Send them to Lisa. Yeah. Because the more open we can be about our learning, then the more as a sector we can learn from each other.
But isn't the performance also, it can be like...
Yeah, absolutely. Yeah, a performance of some shape or form. I've seen almost little theatrical presentations of experience and findings. And the other thing that I think can be really successful is a sharing day, because dissemination isn't just disseminating to the funders or the policymakers, but maybe to the participants. How do you report back to participants? So a sharing day might be a way in which you present your findings to a mixed audience of health partners, participants, funders, policymakers. And the great thing about that is not just what you're presenting from the front of the room about your evaluation findings, but about the direct conversations that can happen between participants and policymakers or funders. Has anybody tried anything like that before?
Performing in the end of field work, just like a part of the reporting, starting to disseminate the written part. First performance and after that written part.
Yeah.
Which is first like a short blog and after that maybe book with audiovisual material.
Yeah, brilliant. And I've seen people design postcards. So I was involved evaluating a project for families experiencing domestic abuse. Quite a hard subject, but they commissioned an artist at the end of the project who made a series of illustrated postcards for the whole alphabet. So A, B, C, D, and every letter of the alphabet represented a word that came up through the evaluation of the project that was illustrated. And that was then exhibited in the theatre in the local town. So it was raising, and we talked about impact and stigma, it was raising awareness of an issue that's quite difficult to talk to. It was taking it into a public venue and enabling conversations to happen around it. But also it was a way of sharing the evaluation. Sometimes people say to me, oh, do we need to do a report then? Could we not just do the postcards or a presentation or a performance? But I think the thing about the written report is it's like, well, I call it the mother plant. So it's the thing to which other things all come back that provide the credibility. So from this, there might be key messages or individual case studies, but it's really important that they relate back to the central mother plant, the central report that explains really clearly what the project was, how you evaluated it, what the full findings were. So if you extract any elements of this to share with particular people, they can come back to the main report. So do you know, do you have here, we call them spider plants. Do you know what I mean by a spider plant? It's a house plant, and it has just kind of thin, spiky leaves, soft, thin, spiky leaves that grow like this. And it sends off long shoots with little baby plants on the end. And this long shoot with a baby plant will land on the earth nearby, and then it will grow a new plant. So I really like that metaphor where the full report, which might be 30 or 40 pages long, if you're me, that's like the mother plant. And dissemination is how you use it to send shoots off to grow new ideas, new projects, new understandings. So data collection, data analysis, reporting, mother plant, spider plant, how you take your learning and ideas out. Maybe you run a training day, because really this training day grew out of a research project that we did together. So maybe you share your learning through training other people, having seminars, workshops. And then, of course, what happens naturally is the evidence that you find through your project becomes evidence that's reviewed when you plan your next project. So if you're evaluating work from an organizational perspective, how do you make sure that the learning from previous work feeds thinking about the next project, what you do next, how you do it, so that this is actually a cycle of continual improvement? And then that brings us back to your evaluation becomes the evidence that's reviewed as you move around it. So the other thing that says to me is an evaluation doesn't have to be something you do once. So maybe if you, I like the way you say, well, really it's taken me 10 years to develop this thinking. Yes, because that's 10 years of going round this cycle in one way or another. So for artists and creatives, I think reflective practice is often an innate way of thinking, an innate way of working, a way of constantly being reflexive and thinking, what's this mean? Why am I doing this? How am I doing this? What's the impact on me, on other people? And that way of experimenting, testing, pushing, reflecting, changing is something that often I think comes naturally to many artist practitioners. And that's part of the evaluation process. So often if I'm teaching and working with creative practitioners, seeing this as a science, as a methodology can be quite alienating, or, I don't know, some people can feel quite intimidated by it. But I think for artist practitioners, the important thing to remember is often this kind of thinking is going on all the time anyway. And this is just a way of perhaps formalizing it in order to be able to share it with other people. So we're kind of back to where we started with, if you do one thing really well, that's better than trying to do everything and then not managing it all. And that if the one thing you do, if the only thing you do is to be able to clearly articulate what you do, why you do it, and why it matters, then that's a really important starting point for any project in terms of the evidence level. So we've closed the circle, and that's really mostly the end of what we wanted to share with you today as part of teaching. I do have a creative evaluation exercise that I would like to try out with you, if you're open.